Welcome to the ACO Show, a podcast about the American healthcare system and some of the people who are working to make it better. I'm Sean Cavanaugh, joined by my co-host, Dr. Josh Israel. Welcome, Josh.
Hey, Sean. Glad to be here with you again.
Well, it's great to have you. And we should acknowledge this is the 200th episode of the ACO Show. I've been lucky to be part of it for a couple months now. But Josh, you've been here for every single one of the 200 episodes.
I have. You're selling yourself short. You've been here for more than a season now. But yeah, I've been very fortunate to do this. We've had some fantastic guests. I've been able to learn a lot, and we appreciate our audience. Thank you for joining and being with us along this journey.
Today, we had a special guest. You want to talk about who it was?
Yeah, we were joined by Dr. Paul Offit. He is the director of the Vaccine Education Center at the Children's Hospital of Philadelphia. Dr. Offit had some great points on sources of information that are reliable for primary care clinicians who are looking to understand what are the best vaccine recommendations for their patients. And he also had some pointers for busy primary care clinicians who are trying to talk to their patients, trying to do shared decision-making during this time of changing information.
Yeah, as you point out, there's a lot going on in vaccines, and I think physicians and their families they treat are wondering what these changes mean for them. And so we were looking to Dr. Offit for some practical advice how they can handle these conversations. So let's listen to Dr. Offit, and we hope you'll join us in future episodes, 201st and onward.
We are now delighted to be joined by Dr. Paul Offit. Dr. Offit is a world-renowned expert on vaccines. He is the director of vaccine education at the Children's Hospital of Pennsylvania, otherwise known as CHOP. Welcome, Dr. Offit.
Thank you. It's my pleasure.
Let's get right into it on the recent CDC recommendation changes. The CDC recently shifted several vaccines, including influenza, rotavirus, Hep A, Hep B, and others, from universal recommendations to shared clinical decision-making. Can you talk about what that means?
Well, so there were three vaccines that were moved to shared clinical decision-making: flu, influenza, COVID, and rotavirus vaccines. Shared clinical decision-making technically means you can make a decision with your healthcare professional as to whether you want to get the vaccine or not. And I think that for all those vaccines, whether it's influenza or COVID or rotavirus, what we had was a recommendation. And we had a recommendation because those vaccines worked and they were safe. In the case of rotavirus, we took what were 55,000 to 70,000 hospitalizations a year in this country in babies, primarily less than 2, and eliminated them, admitted for severe dehydration, gone. In the case of COVID, last year we had about 7,000 children who were hospitalized with COVID. 1 in 5 were admitted to the intensive care unit. Virtually all were unvaccinated. Half were previously healthy, and 152 children died. So is that vaccine of value? Of course it is. Should it be recommended? Of course it should be. And with regard to influenza, last year we had, in 2025, 289 children die of influenza. That's the largest number of influenza deaths since the 2009 swine flu pandemic. And this year, just in January, we've already had 60 deaths in children from influenza. Of course, those vaccines should be recommended. The good news is that the American Academy of Pediatrics has their own childhood vaccine schedule, which fortunately most pediatricians follow.
One of the justifications that the CDC made for this is Denmark already has a system like this. Why is that not a reasonable argument?
So Denmark, for example, doesn't have a rotavirus vaccine. As a consequence, they have essentially equivalent numbers of rotavirus hospitalizations if they were the size of the United States. I mean, Denmark is roughly 3/4 the size of New York City, so they're much smaller. But if you take the number of hospitalizations that they had from rotavirus last year and then extrapolate it to the fact that they're logarithmically smaller than we are, you get roughly the same number of hospitalizations that we had until we eliminated it. I think here, if we believe that if a disease is worthy of prevention, if a disease is causing suffering or hospitalization or death, then we prevent it.
Dr. Offit, you mentioned that the change from a recommendation to shared decision-making implies people have the opportunity to say no, though I presume that was always true. How do you see it playing out very practically in a physician's office?
So that's exactly right. It was always true. You always have the option, for the most part, not to get a vaccine. I mean, many states have religious exemptions to vaccination or philosophical exemptions to vaccination. There are no compulsory vaccines. You always have that option. I think the way this is going to play out in the physician's office is in two ways. I think one is physicians, as I understand it, are getting far more questions than they got before. So they're talking much more with the patient about the importance of vaccines. But I think, at least from the pediatricians that I've spoken to, and this is in like a suburban Philadelphia area, which is a sort of generally upper middle class area, which can be vaccine hesitant, the sense is that they really are ignoring the ACIP and CDC and looking to the American Academy of Pediatrics for their recommendations. And that sort of happened across the country. There are states like Massachusetts or Northeast consortiums or West Coast consortiums that are essentially having their own group of experts to advise them based on the science.
Does the potential move from strongly recommended to this more optional shared decision making, does it affect whether a physician would be liable for the side effects of a vaccine? Has it had any changes to insurance coverage for vaccines?
Right. So there was a paper by Mike Osterholm and others that was published in the Journal of the American Medical Association recently that tried to answer questions like that. Does it matter in terms of liability? Is it going to matter in terms of meaning physician liability? Is it going to matter in terms of the Vaccine for Children's program, which provides typically vaccines for uninsured and underinsured children? I think that for now, physicians can be reassured that they can give all vaccines according to what is the AAP's recommended schedule.
You mentioned AAP and other organizations that are stepping in, and physicians maybe looking to them instead of to the CDC guidance. Is there anything gained or lost in that transfer? Is it better to have the physician societies doing this? Is there any trade-off of having multiple organizations out there looking at this?
I think in the past, we would look to the Advisory Committee for Immunization Practices, which was a group of people who had an expertise in virology, immunology, bacteriology, statistics, epidemiology, who dealt with patients, who advised patients. So we've lost all that. And it's because we used to look to the Advisory Committee for Immunization Practices, used to look to the CDC, one place essentially, to get the best information based on the best science. We don't have that anymore. So now what's happened is it's become fragmented. So you have the American Academy of Pediatrics, or the Infectious Disease Society of America, or the American College of Obstetrics for Gynecology and Gynecology regarding pregnant women to provide that best information based on expert advisory groups. So it's become fragmented. I don't think there's any advantage to that.
You had to try to steel man the arguments that are opposed to vaccines, that are pushing for optionality. How could you frame that? What's a way to think about what is happening that isn't just infuriating? Like, what's a reasonable point of view to consider for the side that is pushing for fewer vaccines?
The side that is pushing for fewer vaccines believes that vaccines are doing more harm than good. Sadly, the good news is there are a lot of physicians that are standing up for the health of children and adults and are forming their own expert advisory committees and are getting that information out there. So there are a lot of places one can look now to find good information, good recommendations based on good science. But it's a little more work now for the physician than it was before.
Dr. Offit, you've spoken a little bit about childhood immunizations, and you referenced the AAP stepping in, but have there been changes to recommendations for adult immunizations as well?
So that's been a little confusing. I think, for example, the human papillomavirus vaccine, there was a working group that was formed in the ACIP to look at the 1 versus 2 doses versus 3 doses. And so now there's just this sort of single recommendation for 1 dose. But again, the American Academy of Pediatrics, as I think outlined clearly, based on age, whether one should get 2 doses or 3 doses. So I think that's good. It's too bad. I think we could have, there was a working group that was formed that's now been disbanded to look at whether one could give a single dose, for example, to the older child, the late adolescent. But I think in terms of adult recommendations, I think that hasn't been as big of an issue. So, for example, I mean, if you're an older adult, see, this is a video thing. So, see, older adults, then you should make sure that you get, especially when you get into your 70s, a respiratory syncytial virus vaccine. You should get an influenza vaccine. You should get a COVID vaccine, because hundreds of thousands of people are being hospitalized with those viruses every year. Tens of thousands of people are dying from those viruses every year. So of course you should protect yourself. There hasn't really been a war against those vaccines yet.
I was wondering, so
by way of background, I used to work at CMS at the Medicare program, and we cared greatly about immunization rates because we knew it led, when there's a bad flu season, we saw death rates go up, and we were there for the benefit of, working for the health of Medicare beneficiaries. Have we seen changes in those vaccination rates among seniors? Are you aware?
I think there has been generally an erosion in vaccine rates, certainly among children, and to a lesser extent among adults. But yes, I think there are some things that are worrisome. So I think what worries me about this is that we're not going to really know the kinds of impact that these viruses are having in those people who are unvaccinated.
I think we can all agree that shared decision making is a good approach. As we've said, it's always been, it's always been an approach that's available to PCPs. But if you are a busy PCP, how can you share the science, share the recommendations for a vaccine without essentially losing your whole day to a couple of patients? Do you have a few key tips PCPs can use to talk through the recommendations?
That's the issue. There are a lot of websites that you can direct someone to. So first of all, our Vaccine Education Center has a tear sheet where we try and go through each vaccine as well as sort of common fears that people have about vaccines. So you can just it's free. You can just download it, just sort of download and then hand that sheet to the patient, say, look at this and see if this can answer your questions. What you're seeing is not surprising, that in the first few years of life, we ask parents to vaccinate their children against 14 different diseases. That can mean as many as 25 inoculations during that time. It can mean as many as 5 shots at one time to prevent diseases most people don't see, using biological fluids most people don't understand. I'm surprised that not everybody is pushing back against vaccines, given those numbers. So I think you have to be enormously sympathetic to the fact that people are more scared of the vaccine than they are of the disease. Most people, I'm a child of the 50s. I had measles, I had mumps, I had German measles, I had chickenpox. I had all those diseases. I was lucky I didn't have meningitis from Hib or pneumococcus or H. flu B. But, my children didn't grow up with these diseases. They haven't seen these diseases. So although we eliminated measles from this country by the year 2000, we also eliminated the memory of measles. I think people don't remember how sick or dead that virus can make you. And so that's what you're dealing with. People aren't scared of the disease anymore because vaccines are in many ways a victim of their own success. That in combination with the fact that there's so much more misinformation and disinformation out there, it's so much more readily available from the internet than ever before that you can see why there's this kind of pushback. So I'm enormously sympathetic to people's fears. I am, and I would never say that's unreasonable. That fear is unreasonable. I think it is reasonable given the kind of information that's out there. But I just think what we need to do is make it clear to people that a choice not to get a vaccine is not a risk-free choice, and it's becoming a riskier and riskier choice to make, as you're seeing what happened last year. In addition, and we've just talked about, we talked about influenza, we talked about measles. Measles was the biggest outbreak we've had in more than 30 years last year. We had more tetanus cases last year than we've had in 10 years. Flu deaths were at an all-time high, at least compared to last time we saw those kind of numbers was the last flu pandemic. And we've had states experiencing pertussis deaths that hadn't experienced pertussis deaths in years. So it's bad out there.
When I did my pediatrics rotation, the memory has stuck with me that outside of the vaccine room at this clinic, they had a stuffed parrot that had some kind of recording device in it. So it would say back what you said. But the thing was stationed outside the vaccine room, hearing what was going on inside and repeating it back. So there was a stuffed parrot in the middle of the clinic all day long saying, "Mommy, stop. Ow, that hurts. Go away." It was terrifying. So it does speak, though, that even with that, parents were still trusting it. Parents were still believing that they should get vaccines.
Yeah, and parents, you want your doctor to like you. I think when you say to your doctor, look, I don't agree with you. I think you're wrong. I don't want to get vaccines. You've taken a critical step away from your doctor. And when your child's sick, you want your doctor to be hooked into your child, and you sort of push the doctor away a little bit. So the doctor is in a powerful position. And I think doctors shouldn't be scared to be passionate about this. My wife, I've watched her sort of go 180 degrees on this. She just used to do the best she could. Okay, let me at least get this vaccine into you, and then this vaccine into you. And then she'd had it. And she said, look, let me love your child. Don't put me in a position where you're asking me to send this child out of this room when I know that this child could come back, with severe pneumococcal infection or measles or severe flu. Please don't put me in that position. Please don't put me in that position. That's not easy for physicians. I mean, we don't like to be confrontational, but on the other hand, she became far more compelling in being able to get people vaccinated with her "let me love your child" approach.
Dr. Offit, a large part of our audience are community-based physicians, primary care physicians, who are participating in accountable care organizations. And that means they've made a deal either with Medicare, Medicaid, sometimes commercial insurers, to be responsible for a population. So the outcomes and cost of that population. If you were in their shoes, how would you think about vaccines in that context? They're trying to use resources efficiently and have the best possible outcomes for their patients.
Right, and to know that if a child isn't vaccinated and suffers a severe pneumococcal infection and is hospitalized, I mean, that's going to be much more difficult for them than someone who's not in that kind of position. But I think that all I can say is that I think we need to, right off the top, explain to people what the risks are of not getting a vaccine, because people think that their child is invulnerable. They do. I mean, my children, not shockingly, were both fully vaccinated, but did I ever imagine they would get one of these infections? No. But that's starting to happen now. And it's getting bad out there. And I think, the job of a parent, the number one job of a parent, is to put their child in the safest position possible. And that's what vaccines do. And it's really hard to watch, for example, those two healthy little girls in West Texas die of measles this past year, a 6-year-old and 8-year-old girl, perfectly healthy, perfectly well nourished. That's the first child death in this country from measles since 2003. That's more than 20 years ago. And I think that's only going to get worse. Measles is always the canary in the coal mine. It's the most contagious infectious disease of man. And so that's always the first one to come back. So that is a warning about how bad this could be. I don't think people realize that measles is an airspace disease. You don't have to have direct contact with someone with measles. You just have to be in their airspace within 2 hours of them being there. That's why it's so highly contagious. And I fear this is only going to get worse. South Carolina is close to 1,000 cases right now. That's when you're starting to see children die. It's usually one per 1,000 children. So it's just so hard to watch this. And I have enormous sympathy for the pediatrician on the ground. It's very easy for me. I'm not in private practice pediatrics, although trained as a pediatrician. And so they're the ones who are handling this where the rubber meets the road. I think all I can offer is be sympathetic, but be forceful to the extent that realize that those children could be the ones who suffer these diseases. And it's just so unconscionable. There's so much in medicine we don't know. There's so much we can't do. This we know. This we can do.
You've given some great tips already about places to look for resources and some language to use for practicing primary care physicians. Any other guidance you would have for folks who are on the ground really dealing with this day to day?
I think what I'm encouraged by is how many people are standing up right now on behalf of children, especially because I'm trained as a pediatrician. But right now it's a tough time. And all I can say for those people who are listening on the front lines, hang in there. I think this will get better, because the most important thing is that science is on our side. And no matter how many people in the current administration stand up and say that vaccines cause autism or diabetes or multiple sclerosis, or that aluminum adjuvants in vaccines are dangerous, it's just not true. I mean, Galileo was forced to recant the fact that he believed correctly in Copernicus's notion that the Earth revolved around the sun. And he was forced to recant that in front of a Roman Catholic tribunal in the 1600s. But what he said when he was walking out is he said, presumably in Italian, and yet he said, referring to the Earth, it still moves. Meaning, you can make me recant it. That doesn't change the science. And the politics may change, but the science doesn't. And science is a powerful thing to have on our side. All we can do is the best we can do, but hang in there. I think we will get through this. But never stray away from the science. I think that is an important thing to know.
Well, we know you're a busy man. Thank you so much for joining and sharing your knowledge and experience.
Thank you.
My pleasure. Thank you.
And for all your work.
Thank you.
You hang in there too.